a great honour to be leading this Royal Commission. It's very important public policy issues for us to think about. How do we improve our response to the needs of people living with a mental illness, their supporters, carers and loved ones, and to the workers who are working in the mental health system and related fields. Through this consultation process and through the Royal Commission, I hope that we make sure that our conclusions, the recommendations that we give to government, are informed about what's needed on the ground, that they are practical, that they can be implemented, and that both the strengths of the current system and the weaknesses will be addressed through the future reforms.
There's no more important problem, no more urgent problem to fix in Australia than mental health. But it's been a low priority for governments. From time to time it rises to the top of the policy agenda, but then gets displaced by other things until there's yet another crisis. Personally, my own daughter, one of them, Isabella, has experienced schizophrenia for over 20 years, and that has a devastating effect on her life and on the life of the family and those around her. So I have some experience of what it's like on the ground.
I think the Royal Commission is incredibly important because it's really a once-in-a-lifetime opportunity to hear from people who've experienced the system in one way or the other. And because it's the highest form of inquiry we have here in Australia, it really gives us the power to dig deep and to find out what may be working, what may not be working so well, and what we can do to actually bring about positive change. I think the first priority for me in terms of a wish list would be to ensure that the voices of consumers are central to a reformed mental health system, so that we're really hearing from those who've experienced it and who know best how it can be reformed.
I've worked in the public health system all my working life, and to have an opportunity to really make significant changes for consumers, families, the community more broadly is such an unbelievable opportunity, and I feel so proud to be a part of this team. I think it's really important that we see this as an opportunity for true reform, not just putting a band-aid on an existing system. I think at the top of my wish list is that the experience for consumers and their families is greatly improved through this process. We're really aware that a lot of people are talking to us through our community consultations about some real challenges in the system, about accessing it, about getting quality services, about having supports to look after the broader issues that impact on people's everyday lives. This is a real chance to make that change.